I'm of course practicing speaking into the camera, and I hope I'll be able to do this without getting emotional. Hi guys, Hawanda's here. Thank you so much for joining me. And right now we're just going to go straight into the video. For those of you who don't know, cancer is it's a sensitive topic for me, and I'll try my best to do this without being emotional. Yeah. So today we are going to learn about mouth ulcers and oral cancers. And a mouth ulcer, I mean, most of us have had an ulcer once, at least once in our lifetime. And an ulcer is just a wound. Sometimes it can be traumatic. Maybe you beat yourself and there was a wound, or it comes when the immune system is low or you're unwell. And these are generally wounds that are very, very uncomfortable, but within a few days they heal. They are very okay. I can go into details, but for now I wanted to discuss about cancer. I think I'll make a different video to talk about ulcers, right? So mouth or oral cancers are of different types, so I'm going to use my small model here to describe a few of the things that I'm going to mention. So cancer can happen anywhere. It can happen on the tongue, it can happen on the gums, it can happen on the roof of the mouth or the palate, it can happen under the tongue, under here, it can happen anywhere around the jaw, it can happen around the throat, so it can happen anywhere. So I want just to give you some signs or symptoms to look out for, so that you can know that this is not normal. Number one, a change on the mucosa is like the lining of the mouth. So if there's a change in color, sometimes it's white, sometimes it's reddish. It just looks very different and strange. And this change persists for more than 2 weeks. So if there's an ulcer that stays for more than 2 weeks, there's a problem there. Color changes, and then you can have unexplained bleeding, unexplained numbness for no reason whatsoever. Color changes and changes in movements, like you find that maybe you're not able to make the normal movement. Swellings, you can get swellings or thickening or lumps. Lumps are very common, by the way. Sometimes you can feel them even under the jaw or around the neck. If you feel those, please rush and see your dentist or your medical practitioner for further investigations, right? And like your voice might change. You might not be able to open the mouth, like what we call trismus. You're unable to open the mouth or move your jaw normally. I mean, this is after it has stayed for some time. And then you can also have painful swallowing, pain in the neck when swallowing, or difficulty in swallowing, or there's a change in the way you bite your teeth. And so finally, if it has taken some time, you might have some dramatic weight loss, like you lose weight and it is totally unexplained. So please don't wait until it gets there. If you notice any change in the mouth, any change in the appearance of the mouth, some red patches, white patches, the extreme discomfort when opening the mouth, or all the things that I have mentioned, please just go and get checked. Do not assume that these ulcers are going to heal on their own. Sometimes we like using over-the-counter medications or herbal remedies. Before you try those ones, just get checked so that it can be ruled out. The thing about cancer is that the earlier it is diagnosed, the easier it is to manage. The longer you take in diagnosing this disease, the more damage it does, and the more difficult it becomes to manage. I remember a case that I did how many years ago, sometime in 2017, that I still remember to date. There's a lady who had cancer that affected her jaw, and we had to resect or cut off half of her jaw. And well, it was not very nice. It's not something that I like to remember. And of course, again, I lost my dad to cancer, and it's not a journey that is easy to walk through. So if you can learn ways to prevent that, the better. The problem about the mouth is you need it to talk, you need it to eat, you need it to just express yourself. And once the mouth is not okay, the rest of the body really suffers. And oral cancer is something that can be detected early and managed early. They have now. I don't want to go into, as I said, I don't want to make it into dentists. I don't want to go into so many details about the types of cancers or the management, or so that one I'll leave it to your dentist. But the most important thing is early checks. Go for your regular dental checkups. If you find anything unusual, go and get checked. Uh, Always do self-examinations, like when you're brushing your teeth. Open the mouth and have a look inside. Look at the tongue, move it around. Check the roof of the mouth, under the tongue. Just look for any changes around the mouth. Remember, this channel is not to substitute your doctor or dentist. You still have to go see your dentist. For me, it is just to put the information out there and to help educate people, the masses, so that at least we are able to put the care of our teeth or of our mouth into our hands, and not just leave our health to chance. Yeah, apart from that, just continue taking care of your mouth, because if you take care of your mouth, it will take care of you.